My name is Arash Samiei. I am a medical doctor, and just to tell you a little bit about my background, since my graduation, I have been interested in doing research in the area of cancer to understand the biology of it and be part of the effort to cure it. My research in this field started as a postdoc research fellow in the Lurie Cancer Center at Northwestern University about 6 years ago. Then I came to Pittsburgh to start my internship in general surgery at the Allegheny General Hospital. Since then, I have been focused on doing clinical research in urology and oncology at Allegheny Health Network. My interest is in prostate cancer, kidney cancer, new diagnostic approaches, and new surgical approaches like robotic surgery. I joined ChemImage as a clinical researcher to support the development of new imaging technology aimed at real-time detection of cancer. I studied medicine because of my passion for science. I believe being a physician is a privilege of having the chance to help another human being. The ability to cure people with diseases and remove their pain always fascinated me. And also, I come from a family of physicians. My father is an OBGYN surgeon, and by witnessing the joy that comes with taking care of patients, I realized becoming a medical doctor is the path for me. I am fortunate to work with such a talented group of people at ChemImage. Everybody is dedicated to achieving the company's mission of making the world safer and healthier through a scientific approach. My background as a medical doctor with experience in surgery and oncological research supports the life science team at ChemImage to not only achieve a better understanding of the need for innovative diagnostic and treatment approaches in the field of medicine, but also help the team to connect the worlds of biology, chemistry, physics, and engineering with the world of medicine. This is a very interesting subject that our team is working on. We submitted this work to the American Association of Urology, which is the biggest conference in the field of urology. Approximately 16,000 doctors and researchers from more than 100 countries around the world gather annually to share the latest research in this field. Fortunately, our abstract not only got published in the Journal of American Urological Association, but also got accepted for the podium talk in the surgical technology and simulation session. And because of the COVID-19 pandemic, all of the presentations will be virtual and people can listen and see the presentation on the AUA website. To talk about our work, we need a little background. As we know, cancer is a huge problem in our society. In 2019 alone, there were more than 1.5 million new cancer cases diagnosed and more than half a million cancer deaths in the United States. The focus of our study is on kidney tumor or renal cell carcinoma, which represents the sixth most frequently diagnosed cancer in men and 10th in women. Treatment of cancer depends on multiple factors, including the location, stage, and grade of primary tumor. Surgery for removing the tumor is one of the primary treatments for local cancers. The goal is to remove the cancer cells completely with minimal damage to the normal tissue around the tumor. The focus of our study is to develop a technology to help the surgeon with detection of cancer cells during surgery with high accuracy to remove all of the cancer cells. As we know, due to the complex nature of cancer surgeries, visualization of tumor cells could be difficult and challenging. We are developing a new innovative imaging technology called molecular chemical imaging that works with analyzing the tissue's behavior in terms of reflection and absorption of light. This is a very safe technology for the patient. It doesn't use any radiation or contrast materials, and there is no tissue damage from light. In this small pilot study performed on human ex vivo tissues, which means tissues removed from the patient in surgery and analyzed in the pathology lab, we showed that we can not only detect kidney tumors, but also different histological tumor subtypes. This information has the potential to help surgeons to make better decisions. In current practice, after the surgeon takes the tumor with surrounding tissues out, it is sent to the pathology lab to be analyzed, which takes 1, 2, or maybe more days to report the type of the tumor. But with this new technology, which is under development, the information could be provided to the surgeon in real time during the surgery. And this info can help the surgeon to choose the best treatment approach after the surgery, like radiotherapy, chemotherapy, or immunotherapy.